That is a CT scanner. It's used as a diagnostic tool to decide whether you have brain bleeding or not. Physical exam done in the emergency room in a doctor's office, on the field, in the rink, will always be the strongest tool to assess how much damage the brain has gone through in any kind of impact. Now that could be in the form of a football head-to-head injury, a hockey collision with the boards, a motor vehicle accident where a driver might not have been wearing a seatbelt and hit the front dashboard. It can be from a fight. So the bottom line is that a physical exam in the diagnosis of concussion is usually good. Adding a CT scan would help in making sure the patient is safe. I use Bob Cantu's grading scale for concussions, and I'll put a link here as far as the Cantu scale. Usually in the state of Illinois, most of the schools under the Illinois High School Association will follow Cantu's suggestions as far as concussion grading. That tells us, and also the parents and the patients and the coaches, about the severity of the concussion, the treatment plan for the concussion, and then the expectations as far as when they get back to sports. It's very important when you have a head that's been shaken. Even if it's a mild injury, the brain, which is enveloped in a cushion of water, when the head stops suddenly, the brain still keeps on going, and it can hit the front and then have something called a contra-coup injury to the opposite side. So you can actually have two areas of bruising to the brain. The problem with bruising is that it usually will stop if you're a healthy person, but as you get older, as you're on any form of medications, if you're on a blood thinner, then that bruising can get worse over the course of time. Anybody that had any form of head trauma, as they hit 80 years of age or with Coumadin, really needs to have a CT scan, at the least, mandatory. When you have a concussion, what sometimes happens is the brain doesn't like to go through any of its functions when areas are swollen. When you have a hit to the impact side and a contra-coup hit to the opposite side, you'll have microscopic swelling, microscopic bleeding. When the brain tissue goes through swelling or bleeding, it won't transmit its electrical impulses fast enough. And sometimes the functions of those two areas, let's say a hit to the front and a contra-coup hit to the back, hit to the front might affect your emotion, might affect your thought processing. It might be a little bit slower in problem solving. A hit to the back might affect your vision, or the control of your eyes, your tolerance to light or sun. So that's just two different areas, but it can be, in effect, disabling for a short amount of time. Depending on how healthy you are, what age you have, which other medicines you're on as far as medical conditions, it might be delayed. But your average bruise, let's call it a bruise, your average bruise on the skin takes about 7 to 10 days to heal up. Average bruise on an internal organ or a delicate structure can be double that. When you have medical conditions or you're on blood thinners, it can be triple that. That's why the rule of thumb is whenever you have any kind of injury, concussion-wise, or traumatic brain injury, you really should not be on any anti-inflammatories for about the first 2 to 4 weeks. Anti-inflammatories will make you bleed more, and you don't want that to occur when you have an area that's secluded to the head after a hit. So that's a good rule of thumb to follow. If you need anything for pain relief during the day, or during the first 2 to 4 weeks, Tylenol or Tylenol extra strength would be fine. No Advil, ibuprofen, Motrin, Naproxen, Aleve, aspirin, or any prescription anti-inflammatories whatsoever. You can do prednisone, which will help with swelling but won't affect the bleeding, but that's about it. For severe pain that Tylenol does not control, then you go to Tylenol with codeine or the stronger things. Usually, if you control the pain, control some of the spasm to the headache that comes, maybe some of the spasm to the trapezius in the form of whiplash, you might be able to turn this thing around quickly. If there's a problem with thought processing, with communication between one hemisphere and the other hemisphere, you might have to go see a neuropsychiatrist. or a neuropsychologist. They will help not only with getting through the pain and the headaches of the post-concussive syndrome, but they'll also help with developing exercises for the brain to have it go back to communicating and processing like it did before. Those are very important and sometimes are not considered in the treatment for concussion. It's also important to make sure sleep is maintained, nutrition is maintained, and in addition, because of the disability that sometimes comes with a concussion or any form of traumatic brain injury, you have to try to control discomfort and pain. That can be with the standard pain medicines. It can also be with psychiatric medicines, Zoloft, Paxil, Prozac. Sometimes they help with a chronic pain condition. As far as herbs to use, you have to be very careful because of the fact that there might be bleeding. Ginkgo biloba is a great medicine for memory, for Alzheimer's disease, but it sometimes makes bleeding worse, so it's a no-no. Anything that increases bleeding and makes the platelets slippery is a no-no, and that's the aspirin we talked about. DrRic is probably a good idea in addition to the things that help with muscle spasm, because anytime there's a headache from the bleeding or the concussion, you'll also have the muscles wrinkle up, the muscles contract, and you'll have the secondary muscle spasms that occur, neck, forehead, temporalis muscles along the sides. So you want to control discomfort and spasm. Massage therapy, physical therapy, magnesium, they all are helpful. Keeping hydrated, definitely important. Avoiding alcohol, that goes without saying. So these are some of the things that we do to first initially diagnose a concussion and make sure it's not a dangerous problem with bleeding. Next, we try to do no further harm in avoiding contact, avoiding further bleeding, avoiding anti-inflammatories, maybe even avoiding sinus infections because that would make the pain worse. And then we try to get patients to rehab faster, or I should say, try to maximize on the healing process that the brain will go through and the patient will go through in the social strata of trying to continue with activities of daily living and work if possible. Once you have your primary care doctor, maybe a neurologist, maybe a neuropsychiatrist, get all on the same page, then it's only a matter of time before the healing time occurs. Sometimes you might have to go past the point of CT scanning and get MRIs or functional MRIs as well. But these are all important things to include to speed up the healing time and compress the time frame of your suffering.